Hemoptysis associated with Paragonimus westermanii. Definitions. Paragonimus westermanii is a major species of lung fluke to infect humans, causing paragonimiasis. The species sometimes is called the Japanese lung fluke or Oriental lung fluke. Human infections are most common in Eastern Asia and in South America. Paragonimus westermanii was discovered when 2 Bengal tigers died of paragonimiasis in zoos in Europe in 1878. Several years later, infections in humans were recognized in Formosa. Pros and cons. Pros. Usually does not require specific immediate treatment, but it should always be thoroughly investigated in case the underlying disorder is life-threatening. Cons. Spitting of blood or blood thinks sputum from the respiratory tract. Hemoptysis occurs when tiny blood vessels that line the lung airways are broken.
The advanced organizer for hemoptysis, that is coughing up blood, was taught to me at Tulane University. I expanded on it a little bit to include more diseases. It doesn't really change what you do in order to figure out hemoptysis, but it does give you a more complete list. The mnemonic is battle camp. Now I know battle camps don't have anything to do with hemoptysis, except that they might transmit TB, but the mnemonic does work, and I will show you how. And some of these, as you can see, I've double lettered. And that is a product of me filling out a more thorough differential. The B in battle camp stands for bronchiectasis or bronchitis. The A is for aspergillus and autoimmune disease. The first T is for TB. The second T is for a pulmonary tumor. L is for lung abscess. And E is for emboli, being of any variety. To cause hemoptysis, the embolism has to be fairly big, but it can be air, placental contents, a DVT-PE, venothromboembolism, or fat, a cholesterol emboli from a fractured bone. It doesn't matter which one it is. If it's sufficiently large enough and infarcts enough of the lung, you get coughing up blood. As we transition over to the camp, you're going to see things like cystic fibrosis, and coagulopathy. The other A's here are vascular, and that is an AVM or a diffuse alveolar hemorrhage. Mitral valve, generally stenosis more than insufficiency. This is more to complete the list, and the idea being that the mitral valve is going to cause that pink frothy sputum associated with CHF and not necessarily hemoptysis. And finally, the most common cause of hemoptysis, pneumonia. Now what we're not going to do in this video is go through how you work up hemoptysis. I just want to present to you a list of diseases that when you think this person could be coughing up blood, what I want you to do is run through this list. I will tell you the first step, though, of working up hemoptysis is to ensure that it is indeed hemoptysis. You're coughing up blood, not throwing up blood. So if someone presents with blood out of their mouth, what you want to do as the first step is decide, is it GI related Is it pulmonary related? Because if it's GI related, you're going to call a gastroenterologist and get an EGD. If it's pulmonary related, you're going to start with a chest x-ray, eventually end up at a CT scan, and not everybody needs a bronch. The way you tell if someone's got GI causes versus pulmonary causes is based on their symptomatology in addition to the hemoptysis. If you've got GI issues, you've got blood in your GI tract, you're generally going to present with nausea and vomiting. But you will not have a cough, and if you do, your sputum will not be streaked with blood. That is, there's no mixing of blood with your sputum. And of course, pulmonary causes are the exact opposite. You are going to have streaked sputum. You will have a cough, and you will most likely not have nausea and vomiting. And that is the approach to hemoptysis, or coughing up blood.
We make these videos for free, and we need your help. Please donate, because without your donations, we can't make any more videos. Please donate.
Application in medicine. A 49-year-old woman who had recently immigrated from Myanmar presented with a 6-month history of rusty brown sputum with hemoptysis. A tuberculin skin test was positive, but sputum smears were negative for acid-fast bacilli, ova, and parasites. A chest radiograph and an axial computed tomographic image show a cavitary lesion in the anterior segment of the left upper lobe, measuring 14 mm in its largest diameter. Ground glass opacities in the right lung. A pretracheal lymph node measuring 11 mm in its largest diameter, and a partially located left pleural effusion.
Alright, so this is going to be a short video, and this might look a little disgusting, but it's the sort of thing that unless you see a picture or see a patient with it, you're not going to know what it looks like. So this patient showed up with coughing up blood, and the big difference with that is, are they coughing up blood clots, or are they coughing up phlegm mixed with blood? It's a big difference. The coughing up blood clots, more likely to be something more severe, bronchiectasis, bronchiectasia, maybe a blood clot to the lungs, maybe a really bad pneumonia, cancer, or something worse. If it's mucus mixed with blood, then it's something less severe. It's almost like when you have a nasal congestion, you blow your nose a lot, then there's going to be some blood in it. And so it's not as serious. So we really need to look at the secretions, at what they're bringing up, and know if it's mixed with blood or is it pure blood what they're bringing up. So let's take a look. This is the sample from the patient here. And like I said, kind of disgusting. But there's a lot of phlegm, green stuff, and then some streaks of red in between. So it's not really just blood coming out or clots of blood coming out, but phlegm mixed with blood. This particular patient had a cough, congestion, a lot of wheezing. So he has bronchitis and is bringing up the phlegm with the blood. So treated with, I did an x-ray. X-ray was negative for pneumonia, but we're still going to treat it because that looks pretty nasty. So we give him antibiotics, inhalers, some steroids, some cough syrup, and that's about it. So hemoptysis, mild versus severe. Severe hemoptysis needs a CAT scan, needs a bronchoscopy, maybe a pulmonary consult. I mean, serious stuff. Gross blood and cough. That's when you call massive hemoptysis, more than a cup a day. That's when it needs a more abundant workup. But if it's less than a cup and they have cough, congestion, wheezing, then it's more likely bronchitis, and you don't really treat it any special than just regular pneumonia, bronchitis, or anything like that. So I hope you learned something about this very short video.
Issue in
See you
Ecuador.
soon. Bye-bye.
There are lots of cases because undercooked crabs. There we can see the parasite inside the animal. Finally, the conclusion. He received treatment with praziquantel, which was followed by clinical and radiographic resolution of disease within 2 months. Paragonimus species are endemic in East Asian countries and are parasites of crustacean-eating mammals. Humans also may serve as reservoir hosts when they eat raw, partially cooked, or poorly processed crustaceans.